Samla Pule English and Foreign Languages University EFLU Shillong campus Ïashim Bynta ringkat ke Shillong Press Club Directorate of Information and Public Relations but ke Meghalaya Editors and Publishers Association ha ke Jinghikai ke sngi bakarpang jungi nongtho Khubor ke National Press Day ke baju penlong menlausnam ha ke khan reu trik unaiwing ya ke ni ke sngi kerpang ki nongtho Khubor memetausnam halor ke phang Changing Nature of the Press Lapenlong ha State Convention Center Shillong hakaba ke SPC di IPR bat ke MEPA ke Lapenlong ye ke jatai hak by day bat ke Jingpang HIV and AIDS ya ke balawan bin penchai di director na ke Meghalaya AIDS Control Society Nakaliang ke kena school bat ke nongtho Khubor ke layo Ïashim Bynta bat ban buru ke jingkali halor ke Jingpang HIV and AIDS hakabau project director Dr. W Langste Dr. L Murthong Deputy Director Medical ba W Darling Deputy Director Prevention Unit Officer kila ay ke Jingpin Shai hagani ke snile don lang ki officer ke tna di IPR bat ke nongtho Khubor
I mean, that's what I'm saying, because we have about 100 cases a month. So 100 cases and another, this November and December, roughly I'm just saying, below 10,000 will be touching it. 10,000 mark will be touching. The case in point, that's the reason why we need actually Meghalaya AIDS Control Society alone cannot work. When we say that we have to end HIV AIDS by 2030, our office alone cannot work, by ourselves. We need the support, we need to join hands collaboratively to actually end it. Which is why so from my side, from our office, we'll definitely come back to your office because we really need those public service announcements to be happening, often maybe on a daily basis. But when it comes to other organizations and all that stuff, they really come forward to us. They do come because they know it's the need of the hour. Because when they come to us, it's not just about HIV, it's also we have to talk about drug abuse as well. Because one of the modes of transmission is through injecting needles and syringes. So that is one of the modes of transmission. So anybody who comes to us, we talk about HIV/AIDS and of course in relation to drug abuse as well. So right now, I think our program is the momentum is really, really building up. The reason why we have more numbers now, that more numbers of people living with HIV coming forward is because of more awareness, sir, because they know now, sir.
They don't even want to talk about these topics. They think these kinds of things so orthodox. As a JMC student, if I get a chance to converse with someone about this serious topic, how can I impact them? How can I make them understand that this is the thing you should know and you have to check it out and you have to do. Sir, can you tell me some?
See, basic, what is HIV? What are the modes of transmission? Because a lot of people don't want to talk about it because they think HIV is like what Paul also said earlier. We had said earlier, right? The major route of transmission is through sexual route, right? Amongst the general population. We always, when we talk about HIV and AIDS, our finger always goes first. It must be through the female sex workers. It must be through the injecting drug users. Or the female, now we also have the female injecting drug users. They're not thinking about themselves. We talk about general population. The sensitization is very, very, very important. Basic info about HIV and AIDS is very, very important actually. If they know about this, I'm sure they'll understand. See, it's not just about UP or Bihar. Even in Meghalaya, we're still having a problem with that. Because me being from the IEC division, I'll be very honest with you. There are times when we go to villages, especially I'll take for example in Jaintia Hills district, where we go to some particular villages for awareness programs, we get thrown out. It's we are going there not to point a finger that there are people living with HIV in your village. We're going there to actually give awareness on how HIV spreads. The point is if they throw us out, don't you think there is certain hidden in that village, right? So that is the cases that we have a problem with. But now I think a little, from what I've seen in the past few years now, especially I'm talking about Meghalaya right now, I think a lot of people are more they're willing to listen actually, and they're willing to talk about it now. So Bihar ka or Madhya Pradesh ka to mero pata nahi, but I hope they'll actually wake up, because when we talk about HIV AIDS, it's not just my duty or your duty, it's everyone's duty, right?
I agree with Ajoy. The best thing is to inform them about HIV/AIDS. Okay, and if you see anyone in your locality, in your neighborhood, or even in your family, those who are involved with any high-risk activity, send them for counseling. Yes. send them for testing. That is the best thing. Because now we are on a campaign of knowing your status, knowing your HIV status. So if you feel you feel that people are at risk, send them for counseling, send them for testing.
I'm from Kerala. The rates are very low, there it's 0.6 or something, but the stigma and stereotype surrounding it is very high. And where do we go? Because if someone's affected, you go to a hospital, but they have so much stigma that they're not willing to treat you. You go to an awareness center. There has been, it's not someone directly affiliated to me, but I've heard cases where they went to these health centers, but there was stigma. They were just appointed there just because they were told to. They didn't want anything to do with the patients. So what's next then?
Think about on the states. I don't know, Meghalaya, we're in what rank? No, I've forgotten actually, but we somewhere there. But this side also the same thing happens. And I'll be very frank with you, especially when it comes to stigma and discrimination, especially what we've seen in Meghalaya. It always happens in hospital settings and educational settings. Hospital settings is worse. Based on the HIV/AIDS Prevention Control Act 2017, a person's status cannot be disclosed. And testing is also not mandatory. We cannot force anybody to do the HIV test, but we encourage them to know the status by coming forward voluntarily to get your test done. But the case in point, when we talk about a person living with HIV, case in point, you said, where that status has been disclosed in that center. So based on that act, if anybody is found to disclose the status of a person, based on the HIV/AIDS Prevention Control Act 2017, they might have to pay a fine of not less than 2 lakhs or go to prison for not less than 2 years. So, because actually, Savage just said because we are actually exceeding our time limit from the 1 hour, I just want to base this. I would just want you all to know that there is an act now protecting people living with HIV. The act is actually to control the spread of HIV and AIDS in the country, as well as to protect the human rights of both infected and affected by HIV. Okay, so now you know point, when you go back to respective states, please inform people that you know. So please don't disclose, if you know of anyone living with HIV and if you think of disclosing the status, don't think. Think about that 2 lakhs rupees, you might just have to say bye-bye to it. Or
not say no. Whenever it comes to me, because we used to have in our this type of that we should not discriminate anybody. So it's my duty to treat. My duty is to make the people not suffer from any diseases. And as a pathologist, I'm to know what type of disease they have. So I don't know why in Kerala it happens like that. I really wonder. Otherwise, we do have surgery also. They'll have their own practices. If they have to do the surgery, they have to do some practices, preventive practices, so that the next surgery will not affect by the instrument used on the patient with infected virus. Okay, and also in civil hospital we used to have, whenever the drug users come, give me a syringe, we just give one, because we don't want to use the same. Okay, so many I've seen. Give me syringe, and we just give. Okay, so that is a way also to prevent them from using the same, spreading of